So some important things, anatomical landmarks which you should know in the posterior mediastinum. And one of that is esophagus. Esophagus starts at the level of C6, where the laryngopharynx ends. It starts at the level of C6. It goes down from the neck, superior mediastinum, and then to the posterior mediastinum, and then goes slightly laterally. इतना नहीं है, थोड़ा ज़्यादा ही निकाला मैंने. Go slightly laterally, pierces the diaphragm at the level of T10. Pierces diaphragm at the level of T10. Okay? And at T11 level, it enters the stomach. It enters the stomach. Okay? The total length of esophagus is 10 inches or 25 centimeters. So the course of esophagus, what we studied, the course of esophagus, what we studied is from neck to superior mediastinum. From there to posterior mediastinum. From posterior mediastinum at T10 pierces the diaphragm, and then it enters the abdomen, and at T11 ends. T11 it ends by entering into stomach. At upper end of the esophagus there is a sphincter which is formed by cricopharyngeus muscle. Cricopharyngeus muscle. Upper end of esophagus there is cricopharyngeus muscle. जरा pause करेंगे. बोलो. So there is cricopharyngeus that forms the upper sphincter. Lower sphincter is called cardiac sphincter. बट मैं इसमें इधर कुछ निकाल नहीं रहा हूँ बिकॉज कार्डियक स्फिंक्टर इज अ फिजियोलॉजिकल स्फिंक्टर. एनाटॉमिकली यू डोंट फील अ स्फिंक्टर एट द लोअर एंड, बट इट देयर इज अ स्फिंक्टर. वो स्फिंक्टर में जब प्रॉब्लम होता है तो स्टमक का एसिड ऊपर आता है. लाइफ में एक बार तो हुआ है सबको, स्पेशली दबा के खाने के बाद जब आप घर पे जाके सो जाते हैं तो बीच में सडन आपकी फिर तभी याद आता है, अपनी माँ वगैरह बोलती ना खा के इमीडिएटली सोने का नहीं, क्योंकि दिस स्फिंक्टर, उस स्फिंक्टर कितना कंट्रोल करेगा ना. ओके, दैट्स नॉट ऑल अबाउट इसोफेगस. Esophagus has four constrictions. The first constriction is here. First constriction is here, where there is cricopharyngeus. So when we are putting a Ryle's tube in the stomach, that time we come across the first constriction. Okay, you feel a resistance. थोड़ा सा पुश मारना पड़ता है. दिस इज 6 इंचेस फ्रॉम द इंसाइजर टिप. तो वो राइल्स ट्यूब पे मार्क रहता है. तो आप ऐसे अंदर डालोगे तो 6 इंचेस का मार्क आता है, तभी समझने का क्रिकोफैरिंजेस तक पहुंचती है. जरा पुश करते हैं थोड़ा सा. ओके, 6 इंचेस. द सेकेंड is when it is, second is at 9 inches. Second is at 9 inches where it is crossed by arch of aorta. 9 inches. इंचेस को डबल रहता है, एक रहता है डबल. क्या होता है, फर्स्ट टाइम मैं मैथ्स में करेक्ट. कौन इतना कॉन्फिडेंटली डबल बोला? क्या बात है, क्या नाम है तुम्हारा? हाँ, कृष्णा तो IIT की जगह इधर आ गया क्या गलती से? ओके ये मैंने बोला था ऐसा जोक मारने का नहीं कर. क्या बोला? अभी क्या बोला? IIT छोड़ो. Third is at 11 inches where it is crossed by the left bronchus. Left bronchus. Left bronchus के ऊपर से arch of aorta जाता है. Okay? Left bronchus. And fourth is when it pierces the diaphragm. This is at 15 inches. And then stomach. So these 4 constrictions of esophagus. Now one more significance in esophagus is that about venous drainage. Arterial supply of the esophagus, upper part is from the inferior thyroid artery, middle part is from the aorta, lower part is from the left gastric artery. So stomach से related. तो उसमें इतना कुछ इशू नहीं है ब्लड सप्लाई में. वीनस ड्रेनेज, आर्टेरियल सप्लाई में इशू नहीं, वीनस ड्रेनेज. Venous drainage, upper part here it drains into hemiazygous, lowermost part drains into hemiazygous and also drains into portal vein. Portal vein. Portal vein via left gastric vein. So left gastric vein and portal vein. And some part is going to hemiazygous. Hemiazygous is going to superior vena cava, so that is systemic veins. This is portal vein. Lower end of the esophagus is a site for portocaval anastomosis. Is a site for portocaval anastomosis. क्यों significant है portocaval anastomosis? In hepatic failure, in hepatic cancer, in hepatic fibrosis, in hepatic cirrhosis, in alcoholics, when blood goes from, everybody look here, blood goes from intestines to liver via portal vein, blood is processed, and from liver via the hepatic veins into inferior vena cava. Okay, so blood is going from intestines to liver via portal vein and then to IVC. Now when liver is damaged, whatever blood is coming from the portal vein comes under pressure, because now the liver, the blood cannot pass like this, and that is called as portal hypertension. So we till coming to medicine, we knew only about systemic hypertension. Last time I told you pulmonary hypertension. Now portal hypertension. So then there is pressure on these veins. This pressure is reflected at sites of portocaval anastomosis. So therefore this will lead to esophageal varices, dilatation of esophageal veins, dilatation of esophageal veins at the pore end. Esophageal varices. Esophageal varices. Varices are dilated. Varicose veins. Till now you have heard the varicose veins of the leg. Varicosity of the esophageal veins. Okay. Esophagus. Other relations. If you just remember those diagrams we had drawn of T5 section, T4 section, anterior least trachea. Okay, so that all you have to remember. So when this liver damage becomes severe and severe and severe and severe, at one point the esophageal varices burst, and then that leads to vomiting of blood by the patient. Vomiting of blood is called hematemesis. Hematemesis. When that person starts vomiting blood, when a patient with hepatic failure starts vomiting blood, that means esophageal varices have burst. And now it's very difficult for, they are under already portal hypertension, for them to again heal. So that is kind of considered as an end point. I knew of a person who had hepatitis, no, not alcoholic, had hepatitis, and my friend was treating him. And then one day morning, we saw some sauce-like thing on his shirt. So we said, "What is this?" I said, "Did you eat some sauce or anything?" "No," he said, "nothing. I felt little vomiting." "But had you eaten sauce?" He said, "No." "Anything red?" "No." And then we realized that was hematemesis. He had vomited, but it was all blood. And he died in 1-2 days. Okay, because that's the end point. Okay, so we'll revise again for you, because you are...
1, 2, 3, start.
So we are discussing esophagus. Esophagus starts at the level of C6, where C6 परत चालू कर delete कर.
1, 2, 3, start.
So we are discussing about esophagus. Esophagus starts at the level of C6, where laryngopharynx ends and esophagus starts. It ends at the level of T11, where esophagus ends and stomach starts. Esophagus runs through a course where it passes from neck at C6 level, passes through superior mediastinum, where it is behind the trachea with recurrent laryngeal nerve in between. That is the important relation. And then it passes through posterior mediastinum. In posterior mediastinum, the aorta is on its left side, crosses laterally. Then at T10, it pierces the diaphragm, and at T11, it joins the stomach. At the lower end, upper end, there is cricopharyngeal sphincter. At the lower end, there is cardiac sphincter. Some significant points about esophagus which you should be knowing. That there are 4 constriction which is measured from the distance from the incisor teeth. So while Ryle's tube has these 4 markings, first marking is 6 inches from the incisor teeth, cricopharyngeus. You feel the resistance while putting the Ryle's tube. Second is where it is crossed by arch of aorta at 11 inches. Third is at 9 inches. Third is when it is crossed by the left bronchus at 11 inches. And fourth is when it pierces diaphragm at 15 inches. That is one. Another is esophagus. The blood supply, upper part is from inferior thyroid, middle is from the arch of aorta, lower is from the left gastric artery. Venous drainage. The lower part drains into hemiazygous and left gastric. Left gastric is a part of portal circulation. So lower end of esophagus is a site for portocaval anastomosis. So in case of liver failure, this veins will dilate. This is called esophageal varices, may burst and can lead to hematemesis, which is kind of an endpoint. Esophagitis, the applied anatomy of the esophagus is esophagitis, where acid damages esophagus, and 2 is TOF, T-O-F, the tracheoesophageal fissure, because they develop from the same source, trachea and esophagus. Sometimes the separation is incomplete. This leads to TOF. So there are multiple types of TOF. Okay, sometimes connected like this, not from here. Typically, a patient will cough out. The newborn, moment is fed milk, it will cough out. So that is TOF. Thank you. तुला esophagitis आणि TOF लिहायचं आहे, लिहून दे. Arterial supply, inferior thyroid artery at the upper part, खूप मोठा आहे ना तो. Middle part is esophageal branches of descending thoracic aorta, and lower down it is the left gastric artery. Okay.
start.
We have talked about the development of, this is the foregut, and from the foregut develops a laryngotracheal diverticulum which forms the trachea. So this upper part is esophagus and trachea. Now if this separation, this tracheoesophageal septum is defective, sometimes the trachea and esophagus may be connected with each other, which is called as TOF. It may be of different types. There may be a connection here. So whenever the newborn will drink milk, that milk will go in the respiratory system, it will come. So we suspect TOF. Here also, it is going directly. Okay, here, not so much damage. Here it will vomit. That vomitus will enter here. So this is to be dealt only by a pediatric surgeon. Therefore, in medicine we have this super specialization called pediatric surgery. So these are the cases which they operate and save life. People curse allopathy, 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 yellow, Ayurveda law. It has definitely in some diseases. Homeopathy definitely useful in some diseases. I'm not denying it. People, hey, allopathy, what bad? What bad allopathy? You cannot do any Ayurveda, you cannot do any homeopathy, any Unani, nothing in such cases. It's only the pediatric surgery which can save that patient. And we today are saving patients with TOF. Previously the patient used to just die because kya kare? Milk is going here. Milk is not going down into the stomach. In just few days the newborn will die. Today medicine is, because of this branch, pediatric surgery, is saving lives of small children born with tracheoesophageal fistula. Thank you.